GHK-Cu rejuvenated the liver to younger proteomic profiling. And so it's not too dissimilar to probably what is I would say the number one focus of most longevity researchers now, which is the cellular reprogramming, right?
Hi Ryan, yeah, so it's great to have you back on the podcast again. It feels like quite a while. So yeah, we've got quite a few topics to dive into. Yeah, so you're a big fan of GHK-Cu. I'm talking more I know in the past we've talked about topical GHK-Cu, but what about for injections? What do you think of it for gene expression?
So, here I think is where you mix a little bit of theory and a little bit of practical implementation. And I can tell you that, in theory, I think it might look pretty good. I think that, there have been multiple studies which show that, GHK can help promote a gene pattern that tends to be younger in expression, which I think makes a lot of sense. We know that, GHK versus GHK-Cu actually have different effect on stem cells, where GHK can help improve stemness of those stem cells, but then GHK-Cu helps with the differentiation of those stem cells. So it can actually help, sort of take it, pluripotent stem cell and help go to the area where you might need it most. And so I think that it's a complex, probably, mechanism of action. And I think that for the skin, it's been proven out to time and time again be amazing. I'm not sure about everywhere else in the body, and if that would be a good thing or a bad thing, for instance. I think, it's a complicated system. And one of the other big things that complicates all of this is that almost everyone I know who's tried GHK-Cu as an injectable has some difficulty with it. The original sort of discovery of GHK-Cu and sort of what it was doing, which is Lauren Pickert was actually looking at the difference in liver protein secretion. And saw that the GHK-Cu rejuvenated the liver to younger proteomic profiling. And so it's not too dissimilar to probably what is I would say the number one focus of most longevity researchers now, which is the cellular reprogramming, right? We've seen it work where if you take younger tissues, transplant them into older individuals, or, blood or plasma, whatever it might be, we see that usually the older tissues get younger and younger individuals, and vice versa. Older tissues make the younger individual older. And so I think that there is something about this cellular milieu of signaling peptides and proteins and things which cause rejuvenation. And I think GHK-Cu is probably one of those, but it's it would it be the same for all tissues as it is in the liver? We know it is for skin. Maybe it's things that have important cellular matrices. Maybe it's not as good for things other places in the body. So I think again it's a little bit too early to say, but I think that it has some potential benefits because of the metalloproteinase inhibitors. I think the stemness, as well as the differentiation, then reducing those inflammatory factors. So I'm hopeful for it. But I think that so far I've seen it be difficult in practice.
Yeah, that's what I'm thinking. I mean, it's on paper it sounds good. The anti-cancer effects, tumor suppressor genes, that kind of thing. And then, as you say about the inflammation, I mean, if you've got high inflammation markers, then maybe, I don't know if it's an indication for use. And if, I don't know, that's probably mine tend to be quite high. My CRP as well as IL-6 tend to be quite high. So I don't know. That's what I'm keen to see on my complete one. See if I'm getting it going in the right direction. So yes, I'm just coming to an end of a GHK-Cu cycle. So yeah, we'll see.
Yeah. And again, there are certain diseases where I would say absolutely, right? Great, it's got great data in COPD, for instance. Reducing that TGF beta pathways. So again, I think it's really promising.